It's shocking. We don't want to hear it. We try to put our hands over our ears, but it doesn't help. The truth remains. The Tulsa area has a worse infant mortality rate than some third world countries. But it's getting better, thanks to the efforts of Tulsa Healthy Start. The infant mortality rate is the number of babies who die before their first birthday per 1,000 live births. This statistic is one element that's used throughout the world to evaluate the health of a population. Tulsa Healthy Start works with women who are at a high risk for a poor birth outcome to improve the health of the pregnancy, birth, and infancy period by providing outreach, education, and case management services to women who are at extreme high risk of having a poor birth outcome. Services are provided throughout the pregnancy and until the child is 2 years of age. In addition, the Community Service Council's Baby Line program provides outreach services for Tulsa Healthy Start by enrolling pregnant women in prenatal care. Moms are getting help. Our babies are getting healthier, thanks to Tulsa Healthy Start. Learn more at www.tulsa-health.org.
My name is Jesse Chambers. I've been in the fatherhood program for about a year now. Trying to further my education on just some of everything, just trying to expand my intellect on the whole ideal of being a parent. And just trying to express to those younger than me what I know. What I'm trying to impress on them is the fact that being a father is not easy, but it's a gift. I want to do better as a father, and being in the fatherhood program, I get a chance to raise my own son, raise my gift.
My name's Patrick Herkner, and I've been in the fatherhood program approximately a year. Healthy Start helped me get better and learn communication, understanding the other side of my wife's problems, understanding marriage, my parenting. I've definitely become a better father through the fatherhood program. I've learned to be a lot more patient and temperate with my children.
My name is Sickle. My role in the Tulsa Healthy Start program is to work with the fathers. What I do is I get referrals from the case managers who often have boyfriends or husbands. And what I do is bring them into the program, and we train and develop them to ultimately become self-sufficient. So some of the rewards of these efforts is that some of them actually, for the first time, have completed something in their lives, whether it's our parenting program or got some type of employment or vocational completion, and we have a few who are in college, and it's rewarding. So I very much enjoy what I do.
You can overcome anything. With the fatherhood program, that's the kind of help that every father needs. If they don't like it at first, believe me, they will, because it works. Thanks to them, I'm better. I was a little off at first, didn't really want help, but with them, I came to them gradually. They still had their hand out for help, and it's been better since then.
In patients with sickle cell disease, abnormal hemoglobin polymerizes when deoxygenated, forming the characteristic sickle-shaped erythrocytes. Abnormal polymerization, along with adhesion of leukocytes and sickled erythrocytes to the endothelium, causes vascular obstruction and tissue ischemia, leading to painful crises. P-selectin functions as a cell adhesion molecule that initiates leukocyte adhesion, mediates abnormal rolling and adhesion of sickled erythrocytes, and binds neutrophils to activated platelets, all contributing to vasoocclusion. Crizanlizumab is a humanized monoclonal antibody that blocks binding to P-selectin. The Phase 2 multicenter SUSTAIN study enrolled 198 patients with sickle cell disease who had from 2 to 10 sickle-related pain crises a year at baseline, and randomized them to high-dose crizanlizumab, low-dose crizanlizumab, or placebo for 52 weeks. The primary outcome was the annual rate of sickle cell-related pain crises, including acute chest syndrome, hepatic and splenic sequestration, and priapism in the high-dose crizanlizumab group as compared with the placebo group. The rate was 1.63 episodes per year in the high-dose crizanlizumab group and 2.98 in the placebo group. The rate in the high-dose but not low-dose crizanlizumab group was significantly lower than the rate with placebo. Analysis of secondary outcomes found that the median time to first and second pain crises was significantly longer in the high-dose crizanlizumab group than in the placebo group. The majority of patients reported at least one adverse event, including headache, back pain, nausea, and arthralgias, but adverse events were no more frequent with active treatment than with placebo. The authors conclude that treatment with the p-selectin inhibitor crizanlizumab significantly reduced the frequency of sickle cell-related pain crises. Full trial results are available at nejm.org.
Everyone has a story, a history, one thing leading to another that makes us who we are. We have different needs and challenges, but one thing we all share is wanting to make our lives the best they can be. If you have Medicare and Medicaid, a dual complete plan from United Healthcare can be a big help. It's a plan that gives you more benefits at no extra cost to you. But it comes with even more, a promise to make sure your plans and healthcare work together and to help you make choices that are right for you, whatever your story may be. To learn more, visit us online for a free guide. Dual Complete from United Healthcare.
Living with sickle cell, it varies from day to day. I have a little 3-year-old and she likes to be carried, and on a bad day I can't carry her because my arm is in too much pain. I'll take pain medication for it and I'll try and go about my day, but a severe pain, it means me going into the ER, maybe staying in the hospital for weeks. With sickle cell disease, it's just constant pain, 10 out of 10 pain, probably like 100 out of 10 pain, and you don't get relief until you get pain medication.
Sickle cell disease can be summed up like this. It is a disease of oxygen deprivation to every organ in the body, and so every organ is affected. We don't have a medication that has been solely made for sickle cell disease. And it's the most common genetic blood disorder in the United States and likely, the world.
Sickle cell disease is a blood disorder that affects red blood cells. Normal red blood cells are round and squishy and flexible. They move easily through blood vessels, whereas sickle cells, they are hard and they're sticky and they're fragile. They start to build up within blood vessels. This obstructs blood flow. Organs aren't getting oxygen that they need, and so as a result, it can cause extreme and severe pain.
We believe our investigational treatment works in sickle cell disease by improving blood flow, by decreasing inflammation, and by decreasing the number of sickled red blood cells. And our preclinical data supports this, and we're hopeful that it may have an impact in patients and reduce their acute and chronic symptoms. A clinical study is a sort of clinical research where they test to see whether an investigational product is safe and efficacious in a patient population. The FDA needs to see those types of studies in order to approve a medicine so that a doctor can prescribe it to a patient down the road.
The STRONG SCD study is a clinical research study that is designed to assess an investigational product and how it may reduce pain in sickle cell disease.
Patients who are eligible for the study will be randomized to either a placebo tablet, which is a sugar pill, or our investigational product. They'll continue on in the study for about a 4 to 5 month period. There'll be exams that will be taken to monitor their response to the investigational product. Individuals will be able to stay on their current sickle cell therapies throughout the duration of the study. Participating in a clinical study requires careful consideration. The investigational product is not yet approved. We're still learning about the safety and efficacy profile of that investigational agent in the clinical study. Incorporating patient feedback into our trial design and what we do every day is incredibly important to us. And so we had a number of discussions with patients prior to designing the study to make sure that we could incorporate what types of things would make a trial easier or more difficult for them so that we could take that into account. So by participating in a clinical study, a patient can really help to advance the research and understanding of sickle cell disease for other patients.
We're all very different. And if we're not in the study, meaning that minorities, women, we may not be able to actually translate that finding to other populations. So it really is important that we have a good mixture of populations participating in clinical trials.
Sickle cell warriors are key aspects of clinical trials because without us, we can't move forward to a potential cure. Sickle cell warriors are people living with sickle cell disease. We're battling this disease every day, and so we're warriors. The message I have for sickle cell warriors would be just to keep fighting and stay informed.
If you'd like to learn more about the STRONG SCD study, speak with your doctor or visit our STRONG SCD website.